We have to see the numbers start to come down. Right now, they're going up at a pretty alarming pace. Right now, we're on track to hit probably 2,000 average daily cases in the near future, and quite possibly 20,000 active cases. Based on the active case to hospitalization ratio, that would imply about 500 to 600 people in hospital. So that's why we've had to bring in targeted measures, because if that number were to continue to increase, if we were to hit, for example, 40,000 active cases in Alberta, then we would be blowing well past the capacity of the healthcare system. So what we need to see is that those numbers come down. So we need to, like before, we need to bend the curve. We need to see a decrease rather than an increase on a sustained basis of the daily new cases and the total active cases. Once we can see that on a sustained basis, let's say for a period of a couple of weeks, then we can safely assume that the vaccines are starting to win, and then we can start moving to relaxing restrictions again. I don't like what we're having to do either. None of us like this. But if the alternative is blowing out our healthcare system, mass cancellation of surgeries, a potential surge in preventable deaths, that is not morally acceptable. We have searched for every alternative tool. We have had less stringent public health restrictions than the vast majority of places around the Western world. We have treated restrictions as a last and limited resort. We've never gone to hard lockdown. We've never had curfews and stay-at-home orders. We've been the only province in Canada that never locked the churches and places of worship, with the exception of 1 out of 10,000 that flagrantly has refused to operate safely. We have had the schools open for in-classroom instruction for 700,000 students since August. We have had less stringent restrictions for businesses than most provinces and U.S. states and European countries over the past year. And so I would say we have tried to take a balanced approach because of our Alberta belief in freedom and personal responsibility. But abstract political principles don't stop people from piling up in intensive care units and threatening the limited capacity of our healthcare system. We've done everything we can to expand the capacity of that healthcare system. We believe that if required under pressure, we can double the number of staffed ICU beds that are available, but there is a limit to that. So I would say to those folks who are upset, I hear them, I truly share their frustration. This has been incredibly painful for all of us. I've had to make decisions with our cabinet I never in my life imagined having to make, but we truly concluded that there has been no credible alternative to avoid large-scale preventable deaths and an overwhelming of the healthcare system. I would say to them, if they know someone in their family or circle of friends who is waiting for breast cancer surgery, is waiting for heart surgery, do they really want us to take the risk of being forced indefinitely to cancel that surgery because we have to move staff from the operating rooms to intensive care? I think the vast majority of Albertans, if they were in our position as decision makers, would make very similar decisions, balanced decisions to protect lives while minimizing the impact of restrictions on society.